Thank you for that. It's really important information. So let's talk about the virus, I guess, more generally. We have many in our community who are very concerned about the virus, and some who feel that this virus is not as serious as a threat as the media may be making it out to be. I've even heard some people claiming that it's no worse or harmful than the flu. So I wanted to know from you both, considering that the coronavirus can technically refer to, or that considering that coronaviruses can technically refer to illnesses ranging from the common cold to something as serious as SARS, what makes this particular coronavirus strain significantly concerning?
Go ahead, Mark. I'll defer to you on these, and if I have anything more to add, I'm not
okay.
a wall.
Sure. So yeah, Jordan, as you said, the coronavirus is a whole family of viruses that have been around for forever, and they cause everything from the common cold and really mild illnesses to SARS and MERS, and now this SARS-CoV-2, which is a novel coronavirus, which means it's a new strain of coronavirus that was just identified, in the last 3 or 4 months. I've told this story to some other folks, but probably, I don't know, Bob, do you remember? It was probably 6 weeks ago. So before we had our first case of this coronavirus in the county, we got a call at the health department from an established physician in the community who was just panicked that we had the first case of coronavirus in the county. So we actually asked for a copy of the lab report, and it was one of the whole gamish of other coronaviruses that have previously been identified and that cause the common cold and everything. So he was on heightened alert, which is good, but it was one of these other coronaviruses. So it was not this coronavirus that we're worried about. So coronavirus is a new strain, a mutation that has been identified just over the last 4 months or so. But it's related to a whole family of viruses that have been around, for a long time.
Okay.
One of the reasons, you had mentioned, Jordan, that some are saying it's significantly worse than the flu, and some are saying it's not significantly worse than the flu. The primary difference is that so much of the population has what we call herd immunity to influenza. And so when there's herd immunity, it means that most of the people in the population have been exposed to this virus previously and have fought it off, oftentimes in childhood. As we see with the coronavirus, it affects everybody, children as well as adults. In children, it's really not much more serious than the flu, but in adults, it is as if not more serious than the flu. And because it affects virtually every adult is getting sick if they're infected with it in some way, sometimes very seriously, and hence overloading our hospital system. So that's the big difference, is that this virus, coronavirus, is causing our hospital system to be overloaded because we have no immunity to it within the population. And that's the big struggle.
Okay.
To add on to that, I think the other things that make it different than the flu is we don't have we're just now getting access to a rapid test for it. So if you go to your doctor with a complaint of a sore throat or concern about the flu, we can do a test for strep throat and flu and have an answer in about 5 or 10 minutes. For the novel coronavirus, we've been waiting sometimes a week or longer for results. There is now a rapid test. We don't have it yet locally here, but hopefully in the next week or 2, we'll have that. And that'll give us a result also within about 10 minutes. There's also no specific treatment for it. If you have the flu, there are treatments that can at least shorten the duration and maybe the severity of symptoms. There is no specific treatment for this particular virus.
Okay. Now, what are the main symptoms associated with this novel coronavirus?
Kind of the big 3 that we have, warn people to be on the lookout for is fever, which is a temperature of 100.4 degrees or higher, cough, and also shortness of breath. So those are kind of the big three. And yet, as we look at the population of people who have been affected here in St. Joseph County, we've also seen an awful lot of headache and just, body aches and general malaise or fatigue, symptoms that we would commonly associate with the flu. While the big three are kind of the worrisome ones and they might be your ticket in to get tested, it's clear, at least from our experience here in the county, that there's a much broader range of symptoms that can include sore throat, can include gastrointestinal complaints like diarrhea and things like that. So it can look like a whole host of other illnesses as well.
Okay.
I would just like to emphasize that though eventually the vast majority of individuals who are sick with coronavirus develop fever, at the onset of symptoms, particularly in the adult population, only about half of individuals will actually have fever then. They'll develop it later. And so fever is not as unfortunately sensitive a test as we would want.
Okay, thank you. Can we talk a little bit about the human to human transmission? So what do we currently know about the human to human transmission of this novel virus? And more specifically, once one person is infected, does the coronavirus appear to be significantly contagious in a human to human context?
Yeah, that's a great question. And there are a couple of ways that we try and look at that. So one is, for one individual who's infected, how many other people are they likely to infect? And, the best we can tell is that the coronavirus is somewhere between probably 2.3 or 2.4 and maybe 2.8 other people. So 2.5 to 3 people will be infected by one person with coronavirus.
Okay.
Flu is a little bit less infectious. It's probably between 2 and 2.3. Measles, on the other hand, is way at the other extreme, like 18 to 20 people. The other piece that we look at is there's some data that suggests for household contacts of somebody who's infected with coronavirus, that 10 to 15% of them are likely to get infected. So, it is a little more infectious than the flu, but not dramatically so, which suggests that the common precautions for respiratory illnesses, like frequent hand washing and not touching your face like I just did, because I'm a guy who wears glasses, so I'm messing with my face all the time, covering your cough and sneeze, and now especially attention to physical distancing, all those measures should help. And in fact, there's evidence to suggest that they have been helping.
Okay. So in terms of like screening or testing for the coronavirus and staying generally cognizant of the outbreak as it continues to develop, what do people need to know to protect themselves and avoid getting sick? So to kind of put it another way, do we need to do much else outside of our usual cold and flu prevention strategies, such as like regularly washing our hands, getting enough rest and fluids, staying home when sick, to stay safe during this outbreak, or are there extra precautions that we need to take?
Yeah, another great question. So all those usual precautions apply, all the things that you just said, especially the staying home when you're sick, which can be challenging, especially for people living on the margins. So that's an important concern. Excuse me, that's seasonal allergies. It's not the coronavirus. I get this every year at this time. The other thing is that there's also good evidence that when people are symptomatic with the coronavirus, that's when they're most infectious, but they're also infectious even before they develop symptoms. And that makes it really hard to gauge. So you might feel great today, you might be infected, and you could pass it on to your family member, your housemate, or whoever. That's one of the things that makes it so hard to protect against it. And so that's why these mitigation strategies of work from home, really trying to hunker down and stay at home. If you have to go out in public, to really pay attention to that physical distancing are so important. These viruses spread mostly through contact and droplets. And certainly as the weather warms up, as it had the last few days, not so much today, and the air becomes more humid, those droplets don't travel as far. So that's part of the hope that will slow the transmission of the virus. But because it's more infectious than the flu, and because there is, at least some degree of transmission even before you develop symptoms, that makes it more challenging to enact all those safeguards, which is why all the advice that you suggested is so important.
Okay. Can you talk a little bit about the face masks or the mouth coverings? I saw an interview that you did a couple of days ago, and I thought it was really interesting because you kind of were like reluctant to endorse this idea that covering your mouth is one of the most preventative ways of not catching it.
Yeah. So,
Yourself.
well, there are a whole spectrum of different kinds of face masks. So you may have heard about N95 respirators, which are very high quality medical grade things that are actually fit to, if you have facial hair, it doesn't fit right. If you lose weight, it doesn't fit right. So they go through a pretty rigorous process to make sure that particles can't be transmitted. Those are for medical workers involved in direct care of patients with coronavirus or suspected to have coronavirus. Then there are regular masks that would be worn in the operating room for surgery and things like that. Those are very good at decreasing the amount of virus particles that are present when you exhale. So there's good data about that. So for those, the people who don't have symptoms yet, but who may have been exposed, if they wear the face mask, then they're not likely to infect other people if they're wearing a surgical face mask. Because of the shortage of protective equipment in the community and in the state and really around the nation right now, the recommendation is that those really be reserved for people working in healthcare settings. So the suggestion has been made that the general public should consider wearing just a cloth face mask when they're out in public, so that if they're in that asymptomatic state, but where they are at risk of transmitting the virus to others, that might offer some protection. It offers some protection, but certainly not as much as a surgical face mask. And, I was really disheartened to see on the CDC website, at least as of earlier this week, they had 3 different designs that they considered acceptable for these cloth face masks. One of them was literally to take an old t-shirt and cut it off, straps, and tie that to your face. That does next to nothing.
Oh, wow. Okay. Mm-hmm.
The best cloth face masks have at least 2 layers of, a thread count of 180 or higher. So tightly woven fabric. They need to be able to be washed in hot water and stand up to that. The other thing is you have to make sure you don't contaminate it. So I really saw someone in the store the other day who pulled down his cloth face mask and scratched at his face and talked on his phone and then pulled his mask up and then adjusted it. And he just contaminated it about 7 different ways. So that mask really is not effective at that point. And my concern, and I think Bob and I, we talked through this, our concern is that people will think, oh, I've got a t-shirt face mask on and I'm Superman now, and I can go out in public and breathe wherever and cough wherever and do whatever I want. And the most important things are to stay home as much as you can if you have to go out, to make sure that you're practicing good hand hygiene, maintaining physical distance, and then especially for people in high-risk populations, there may be some benefit to a high-quality cloth face mask in those settings where it's harder to maintain physical distance. But they absolutely will never replace physical distance unless you have the very high-quality medical grade N95 respirator that nurses and doctors and other people wear in the healthcare setting.
You know, Jordan, Mark made that comment about Superman there. And of course, looking at a manual on the screen and Dr. Fox right there, I can see the Superman. But the point I wanted to make was that this coronavirus is anything but Superman. Though it is causing horrible damage across our globe, it's a very weak virus in the sense that it's destroyed by soap and water. It's destroyed by alcohol. And this is why we recommend washing for 20 seconds. Because it's 20 seconds of that soap. It's not that you're trying to wash the virus off your hand so much as the soap will break down that virus particle. The alcohol will break down the virus particle. And if you do it for 20 seconds with the soap, it'll do a terrific job.
All right, thank you for that. I really appreciate that that information and and those clarifying points. Let's talk a little bit more specifically about what's happening in St. Joe County. So there's been some newly released data, and we see that based on that data that the share of positive cases among Black people or African Americans and Latinos is equal to or proportionate to our share of the county population. But we make up a majority of those who are hospitalized at 26%. Respectively for Blacks and Latinos, constituting about 52% of those hospitalized in total. It is a small number of cases, it's 19. But can you talk a little bit about like how many tests have been given out and some of the demographic data that was released today?
Yeah, I'm happy to. So the number of tests that have been performed is a little bit slippery, but it's 2,500-ish, so 2,500-ish people have been tested. So to have 150-ish, a little more, 154 positive results out of that, is actually a lower rate of infection than we would have expected, given data from other settings. Although I don't, I'm not really consoling myself with that because we've had reasonable access to testing, but certainly not unlimited. And our concern is that it's been heavily weighted toward the eastern part of the county. If you live in Mishawaka, you can go get a test, within about 2 miles of where you live, probably. If you live in the western part of the county, it's much more challenging. So that's our big priority over the next week or so, is to get more testing sites on the western side of the county. But as you said, among the total confirmed cases, yeah, African Americans are at about 13% of positive tests, and I think about 13% of St. Joseph County. Hispanics may be a little bit disproportionate, and the higher portion among confirmed cases than their representation in the general population, but close enough for government work, but significantly higher among the people that are hospitalized. We don't have enough data yet about what the underlying factors are there. Mm-hmm. Our concern is that people of color probably have decreased access to testing. And so actually our test results may not accurately reflect what's truly happening in the community. They may have poorer access to care or less access to insurance, and so may be more reluctant to seek care until late, and that may contribute to higher rates of hospitalization. They may also have more significant underlying health problems for all the reasons that we've just said, as well as others that contribute to them needing hospitalization at a higher rate. So all of that, is concerning, and especially given some of the data that's come out of some of the hotspots around the country, something to be attentive to.
Yeah, that's that's been a growing concern for a number of Black organizations and communities. Just thinking about the underlying conditions that are really rampant among low-income folks and communities of color. So some of those conditions are like asthma, hypertension, heart disease, And from what I've heard from some experts, some medical professionals, is that if you have 3 or more of these underlying health conditions, that puts you at that makes you more severely at risk of dying from this coronavirus. So are you saying, when you talk about the testing that we've seen so far may not accurately represent what's out there? And then you kind of mentioned that folks on the west side of the county have less access to testing. Are you saying that we're going to look to doing more testing on the west side of the county so that maybe we can get a more accurate picture of what's happening and what's out there?
Yeah, absolutely. So one thing real quick, I happened to see a comment in the chat box that's relevant to what we're talking about right now. You know, I'd said African Americans are about 13% of the population of the county is my recollection. Don't swear to that. It's plus or minus a little bit, not the city specifically. That was speaking to the county as a whole. But Jordan, to your question, yeah, we're looking at setting up 2 additional testing sites on the west side of the county, one closer to downtown, one a little further out, probably further out Western Avenue. We're trying to find the right location for it. Yeah, our concern is that people on the west side of the county have not had as good access to testing. And so if we look at all the tests performed, I don't think it's reflective of the general racial and ethnic distribution of our county as a whole. And so we may have sampled a smaller proportion of African Americans, and yet they already represent, 13% of those testing positive. So if we had more proportionate testing, the number actually may be greater, especially as you noted in your comments at the beginning. It's very often people of color that are in these frontline jobs, whether it's in healthcare settings or in grocery stores or postal carriers and delivery jobs, things like that. So they're out in the community and they're being exposed and at risk of being exposed to the virus. And so that's a really legitimate concern. And that's what we're trying to address.
If I could clarify one thing though, when Mark talks about sampling, we actually have not gotten to the point where we're doing any sort of scientific sampling to get a sense of what's going on in all of the communities. The reason for this is because the testing supplies initially were so limited and the reagents were so limited that only persons who had symptoms could get tested.
Right.
Then they had to be even, a certain, healthcare workers, nursing home, et cetera. And because of that, we really don't know, if you will, what the denominator is of, we're seeing a skewed population of people who are getting tested and who are then testing positive. There's not much anybody could have done about that. The testing supplies just weren't there. As they become more available, our hope is that will change.
Okay, and there was a question down here. Do we know what proportion of each of the population groups that we've been talking about have been tested?
We don't, unfortunately.
Okay.
Yeah, that's really challenging data to get a handle on, unfortunately.
We don't do the test. The Department of Health doesn't do the testing, just to clarify. The testing is done by several different organizations: LabCorp, Quest, Mayo Clinic, IU Health, or Lilly, ISDH, Indiana State Department of Health. The Indiana State Department of Health just yesterday, I think, is requiring reporting of all negatives. They had been requiring just positives, so we were able to get a handle on the positives. We're thrilled that they're now requiring reporting of negatives. I hope it comes with demographic data, but I don't know if it will at this point. I just haven't seen it. Mark, maybe you do.
Yeah, unfortunately, the data that we get at the local health department is a feed from the lab that has name, date of birth, and sex. It doesn't have any or ethnic information. So when there's a positive case, our nurses, when they're doing contact tracing, actually gather that information. So that's actually the source of our information. So we don't have it for all the negatives that come through. So we're just speculating by the distribution of where the testing sites have been, that's why our fear is that it's oversampled the white population.
In answer to the question on the chat, while Mark was talking there, the data is supposed to, by law, has to be reported to the Indiana State Department of Health. We're able to access that database. We also get reports from physicians in the county. They will report to us, but they don't report the negatives. They only report the positives to us.
Just on this issue of like potential barriers to getting at the most definitive, I guess you can say, like, information. So we know that access to healthcare, access to health insurance is a major issue. What is your best advice to those who are reluctant to call in or report symptoms because they lack healthcare?
That's a great question, and also one of our concerns. So, if you watch the presidential briefings, first of all, bless your heart. But second of all, there are all these proclamations that anyone who can get a test, anyone who wants a test can get a test. That certainly has not been the case to this point in our county or anywhere in the country that I know of. And that, the tests will be covered by insurance, which is great if you have insurance, and it doesn't speak to the issue of if you don't have insurance. And so our concern is that people, have legitimate fear about, are they going to be burdened with the cost of a visit and the cost of a test if they don't have insurance? We've worked closely with the local healthcare systems who have said, yeah, we're not going to charge for the visit. We want to get people evaluated, figure out if they need a test, and get them a test. The test itself is not billed for by the healthcare provider, but it may be billed by the lab company itself. And so, again, the government has said these tests will all be covered. They've not defined the mechanism by which we make sure that's the case. So we're trying to work. LabCorp is a local, national testing company. They're probably doing between 90 and 95% of all the tests in St. Joseph County. So we're trying to work with them, especially on the uninsured patients. So one, they can get paid something. Obviously there's a cost to them to do it, but also, and more importantly, to protect from the patient getting stuck with some bill for the lab test on the back end. So it's an imperfect system. We can get you access to the clinical evaluation and get you access to the test. We're trying to address the back end issue of making sure that there's not a bill hanging out there with somebody's name on it. So it's not a problem that we've entirely solved, but we're lucky in that the healthcare systems have been willing to take all comers for the evaluation and getting the test done.
I want to open up a poll question, and it's regarding voting. So we know that our Indiana primary has been pushed back to Tuesday, June 2nd. Emmanuel, if you can launch the poll now, that'd be great. I wanted to ask our two guests, what are your thoughts on in-person voting? Do you think it's safe for voters to go out? Do you think it'll be safe by that time? Tuesday, June 2nd, there was a lot of news coverage around the Wisconsin primary and how many felt that voters were being put at risk by being encouraged to go out and vote. What are your thoughts on that?
I think the world could look very different by June 2nd, and it could look dramatically better and it could look dramatically worse. My concern is that even if we think that the situation looks dramatically better by June 2nd, it wouldn't take much to see a resurgence of the virus, later. And if you look at the 1918 flu epidemic, that's what happened. The places that decreased the restrictions saw a resurgence in the influenza in the 1918 epidemic. So our concern is that if we take our foot off the gas too soon, we'll just see an uptick in these numbers. I think it probably is possible to maintain some physical distancing for voting. It's not convenient for anyone, the poll workers or the voters. So that, to me, is not ideal. And I haven't seen evidence that absentee ballots really generate as much fraud as some people try to let on. So I'd actually be more comfortable with absentee balloting as a way to get through the primary. But I'm not a political scientist and I'm not a politician, so take that for what it's worth.
But from your perspective, would you so are you advising folks to lean more towards absentee mail-in ballot voting, or?
I would love to see the county and the state, pursue mail-in or absentee ballots in some way. Just because I'm afraid if we have people congregating, it will lead to a resurgence of the virus, and that would have a worse consequence for our community.
Yeah.
I'm worried, yeah, and if we get resurgence, I'm worried that we'll see what happened in Wisconsin, in that they'll insist on having the election. The staff to man the voting booths will not be there, and so people will be waiting in line for hours and hours. I think that if one can do absentee voting, one should do absentee voting, and I would encourage that.
And can you say a little bit more before we talk about these results here? Can you talk a little bit about that? You had mentioned that we're a little bit like our spike in cases and the number of cases will come a little bit after the nation's towards, I'm assuming, I think you kind of hinted at the end of April. Can you say a little more about why that is?
Yeah, so I think there are a couple of factors. One, there are several different models that have been developed trying to project this. Some that get down to, of a more local level, others that kind of stop at the state level. So one of the best models seems to be, it's called the Murray model from the Institute for Health Measurement and Evaluation, I think, IHME, out of the University of Washington. And that actually suggests that nationally, the peak resource utilization is only about 2 days away. And that's taking in all these big hotspots like New York and Detroit and other places. They get down to the state level and they say that the peak resource utilization for Indiana will be next week on April 14th. That's largely driven by Indianapolis. Big academic health centers, the most hospital beds in the state, the biggest population in the state, all of that. And when we look at the mitigation strategies employed both at the local and county level, as well as at the state level, especially the state ones were put in place simultaneously when the burden of disease in St. Joseph County was far less than what it was in Indianapolis. And so we have more lead time to realize the benefits of those mitigation strategies, which is why our best projection is that we're likely to trail Indianapolis by 2 to 3 weeks. And so if we keep all these restrictions and mitigation strategies in place well beyond that 2 to 3 weeks, then we'll realize the full benefit of it. If we let our foot off the gas anytime in the next 2 weeks, then it will be worse than it would be otherwise.
All right. Thank you. Appreciate that. So I'm going to do a little response to our polls here, talk about this. So it looks like 79% of respondents to the question of which of these are true statements regarding the 2020 Indiana primary. And again, 79% of folks said all of the above, which is correct. So thank you all for participating in that. And I want to go to the questions here. Early on, there were some questions that were submitted about what's happening in our county jails. We see news across the country talking about how we're seeing hot spots in our jails, particularly in Cook County, Chicago jails. What are we doing in St. Joe County jails to protect our inmates? Are we testing staff? Are we testing inmates? What precautionary measures are we implementing?
The inmate population here in St. Joe County, of course, has its own medical staff, and they're on site there 24/7, and so they are responsible for the care, the treatment, the prevention of COVID-19 in that population. And they have set up testing and are well equipped to test all individuals who present with symptoms as well. They are following fevers of all staff and following temperatures, that is, of their staff, and ensuring to the best of their ability that individuals who are ill are not coming to work. That is of the staff, of course. They have, of course, the jail itself does not have authority to release inmates, but they have been in communication, of course, with the judges who do have that authority, and they have reduced the population of the jail fairly significantly. And the data that was given to me just yesterday was that the jail population had been 611 a month or so ago, and now it's down to 455. The maximum capacity of the jail is 829. What that means is that if they do have a case of COVID, and they've not had a case of COVID in either staff or a inmate, but if they do have a case of COVID, they are going to be able to isolate that individual, or for that matter, when they have an individual who is having symptoms and under investigation, the test is not back yet, they can successfully isolate that individual and hence reduce the risk both to the staff and to the inmate population.
So do we have enough PPE? There's like growing concern around, do we have enough available beds, ventilators, masks? Do we have that in our health centers? Do we have that in our jails? You talked about isolate or quarantining positive cases. Do we have enough protective equipment?
We do at this point have enough protective equipment within the jails. The biggest concern is for the individuals who are on the front lines in the hospital, and particularly in the intensive care units, the emergency rooms, where the nurses and the physicians and the respiratory therapists are literally putting their lives on the line here. And the PPE has been conserved. The level of PPE that is used is perhaps a little bit less than what we would want for any of the individuals working there. That is, the N95 masks are not as abundant as we would wish, and so they're using more of a surgical mask when I think many of them would have preferred to have used an N95 mask. But that said, the amount of PPE has become more available lately. Still a challenge for us. In terms of ventilators, the problem that we see, or that we anticipate seeing if we get a surge here in St. Joe County, is not so much the number of ventilators, but the individuals who are able to manage the ventilators. And this, of course, requires a skilled nurse, skilled respiratory therapist, skilled physician working in teams to manage these ventilators. If some of these personnel become ill, if the numbers of infected patients rise significantly, the biggest challenge that we think we may have here is one of adequate personnel.
Appreciate that response. There's also a question about, can you describe the plan for protecting, testing, and quarantining as necessary our homeless community?
That's actually been probably the biggest challenge that both Bob and I have been dealing with over the last really 2 weeks. Our biggest concern is trying to keep this virus out of any institutional setting, whether that's a nursing home or the jail or a homeless shelter or a group home for the disabled, you name it. a convent, if we can limit exposure in settings where large numbers of people are living, you know, in a group like that, that will help decrease the burden on our healthcare system. And so the homeless shelters, Hope Ministries and Center for the Homeless, and Weather Amnesty and other programs, you know, it's important that we decrease exposure there. They have limited opportunities to actually effectively put people in isolation or quarantine within their facilities. And so we've recognized that as a need. We had been working with homeless service providers trying to come up with a strategy of how to approach this. The city was prepared to offer up the O'Brien Community Center, or Rec Center, as a facility, which is okay, but probably not great for a number of reasons. We have worked now with what, Bob, 7 or 8 to 10 different hotel partners who are very willing to house healthcare workers and EMS providers and stuff who, you know, needed a bed, and they were far less interested in providing an isolation and quarantine facility for homeless individuals. Every time we felt like we were close, we'd hit a snag. I don't want to jinx us this time, but I think we're this close to having that finalized, so that it would be effectively an extension of any of the homeless service providers providing beds for individuals who either have been diagnosed with the coronavirus or who have been exposed and are awaiting test results. So it's not a medical facility as much as it's a home for them to go home to until they're well enough to go back to whatever their normal residence is. But it's been, you know, I think we have people who are willing to staff it. We have people that are willing to volunteer there. We've addressed a lot of those concerns. We have a mechanism for getting them food and all this, but literally finding a partner, you know, we'd reached out to the universities in town. Most of their dorm rooms they don't have people in them, but they have all the students' belongings in them. So that would have been an ideal and maybe an easy solution if they were actually vacant. But because students didn't come back from spring break, their possessions are still in those dorm rooms. But that's been the most nagging challenge over the last 2 weeks. It's just been hard to get to the finish line, but I'm very hopeful that we're very close now.
Okay. I had there's a follow-up question here regarding the lack of personnel and the chance that the virus might return, or we might see an uptick in the increase of cases in the fall. If that is what are we going to do essentially if we don't have the appropriate trained or a number of personnel who can handle the ventilators and such? Is there, you know, local municipalities around that will, you know, help and provide personnel? Because it's not that we're just servicing folks here in St. Joe County. We're servicing folks from around the 2nd Congressional District, from what I've seen and read online.
Absolutely. You know, our hospitals are net importers, so more patients come into St. Joseph County for their hospital-based care rather than go out. So we fully expect to see patients from other counties that come here. So that's one of the challenges in trying to project what the demand is. If you look around the country, yeah, there have been a lot of different areas that have recruited healthcare providers to come in to help meet the demand when surge hits. That's why our focus really has been on this idea of flattening the curve, because if we have, I don't know, pick a number, if we have 1,000 patients admitted to local hospitals, if they all come in the next 2 weeks, we're in a world of hurt no matter what. If the same number of patients come over the next 2 months instead of 2 weeks, that would be difficult, but not impossible. And if they come over 3 months, then we're much better off. So, so it's not even the absolute number of patients that require admission. It's really the time frame in which they all show up.
Oh, okay. Mm-hmm.
These mitigation strategies are so important. The other thing that's important to realize is, for right now at least, the health systems really have stopped all elective surgeries. This looks very much like a hospital over the winter holidays. You know, at Christmas, people aren't doing elective surgeries by and large. So the hospital census is as low as you'll see typically over the winter holidays. But people are still having babies and still having heart attacks and strokes and having infections that require hospital care. But there's not a lot of additional stuff in the hospital right now. So we have to be able to provide care for all the usual stuff and then stretch out the demand for coronavirus care over absolutely as long a period as we possibly can.
To add to that, Jorden, I think there is a notion among some people that, well, maybe if we can just get past the 2 weeks, everything will be okay. And we can open up the economy and it can be business back to usual. But that's not what's going to happen. Or if it does happen, we're going to have another surge and we're going to be right back in the predicament that we're in right now. Until we have adequate PPE to ensure that all of the healthcare providers are safe, and when I say adequate, not just to take care of the COVID patients, but as well, these elective surgeries, knee replacements, et cetera, all these need masks, for example. So we need to have adequate numbers of adequate PPE, and we need to ensure that we have adequate number of staff and ventilators, as we talked about previously. And ultimately, we'll hope for a vaccine, though we'll have to probably get back to work, not probably, we will get back to work to a degree before we have a vaccine, but a vaccine's at least a year off. And so we'll need to be changing our culture as we know it.
Are we tracking positive cases and the folks they come in contact with? And if we know who they've been in contact with, are we testing those folks, or are we just simply like asking them about like whether or not they have any symptoms and encouraging them to self-isolate?
Yeah, so whenever a positive case is identified, our team of public health nurses does what's called contact tracing. And there are really 3 different time frames that we're interested in. So from the time somebody goes and gets a test, they should be sent home to what's called self-isolate until they have a result. So hopefully their exposure is really limited only to people in their immediate household, and even that should be limited as much as possible. But we're also worried about the time frame from when they first became symptomatic until they went and got a test. So we're trying to figure out, where did you go, who did you see, and especially who were you within that 6 foot, but really within a 2 or 3 foot zone for more than a few minutes or more than 10 minutes. So it's what's considered prolonged close contact. Well, a lot of people can probably give you a sense of, well, from the time I was symptomatic till I got tested, I went to work, I went to the grocery store. So they have some time points that they can mark that. But because we know that people can be shedding the virus and can be contagious in the period before they develop symptoms, then we're trying to figure out, was there a known source of contact, either by travel to a region or exposure to a known case or exposure to somebody who was sick and then later tested positive. So we're trying to figure out if there's an exposure. That's not always possible, but we're trying to figure out what happened in that period before they became symptomatic. That's much harder to pin down because there aren't good hard points of reference a lot of time. But we're trying to identify anybody who had prolonged close contact, following up with them to see if they're symptomatic. In general, we don't test them if they have absolutely no symptoms.
Okay.
So we encourage them to monitor themselves for the development of symptoms. And then if they develop symptoms, obviously to self-isolate, but also to go and get tested. But yeah, our nurses go through a pretty extensive process of contact tracing, trying to identify all those exposures.
And the reason we don't test them when they don't have symptoms is that the test is likely to be negative, even if they're early on in incubating this virus. It's just going to be negative, so not a good use of the test.
So that kind of leaves, I'm sorry, we have just a few more questions. I want to make sure I get to as many as I can. And I know,
questions, by the way, I think they're terrific. I'm happy to run. We can stay. I don't know about Mark. We can talk about every single one of these questions, but run through them all, give answers to them.
oh, okay, yeah, that'd be great. I'm sure people want to know, and we want to provide this opportunity for folks. So I'm sorry, there's been a lot of questions, and I'm trying to get through them all. Scroll back here. So there's one from someone. Is it accurate that people that recover from COVID-19 recover after 2 weeks based on the data you have? And then it goes on to say, after looking at the data for 2 weeks, it seems that the virus could still be present after 2 weeks?
That is correct. Now, the time to recovery, of course, varies by individual. Those who are sicker take longer to recover. Those in the hospital may be 2-3 weeks in the hospital before they recover. It is true that individuals continue to, if you will, shed the virus even after they have fully recovered symptomatically. So they will have no symptoms, and some of them, if you test them, even after they're free of all symptoms, one can still find evidence of the virus. What we don't know is whether that virus is still infectious or not. And it's just an unknown. We just don't know.
So Elizabeth asks, when test results are taking much longer in Indiana to come back than in other states, and Dr. Fox, you talked about this a little bit on the news, will we have a sharper curve and more positive results? I think the turnaround time now on average is 5 days, right? According to the data you put out yesterday, you released yesterday?
Yeah, when you look at all of the positive tests that have come back, the average time to result is just over 5 days.
Mm-hmm.
But for all the tests that have come back in the last 5 days, the average time to result is just over a day. So
okay.
We've clearly gotten much better in the last 5 days. So for most of, from the time we had our first case in St. Joseph County, much of that time we've been living in the past. Results were taking 5 to 7 to 10 days. And so whatever I told you now reflected what was happening a week ago. Now I feel like what I'm telling you reflects reality over the last day or two. That's a much better place to be in. And with that, it does seem the curve is by no means flat, but the rise certainly is not as steep as what it had been, even at this time last week. So there's some encouraging signs, but we haven't completely flattened yet. So I don't want to give false hope either.
And can you speak a little bit to the number of cases each day? You showed some data where some weeks ago, the number of cases was pretty high, and then it sort of dropped, and now it's kind of been up and down.
Yeah, it bounces around a little bit. And there are a couple different ways to look at it. We look at the positive result because of that time lag in getting results. For a while, we were trying to follow the positives based on the date the test was obtained. So even though we got the result today, if it was obtained a week ago, we were trying to track what was happening a week ago. So again, now that we're getting faster turnaround, we're closer to real-time data. But we follow both the date that the test was obtained and the date the result came back so that we can identify if there are patterns. But there still is considerable variability. We'll have, last weekend we had a couple days where we had, 13 to 20 positive results come back in a day. I think from today to yesterday, oh gosh, I'm going to butcher this. It was 8 or I think it was 9 from yesterday to today. but the day before that it was only 4. So there's still some variability there.
Okay. Ellen asked, she noted that you said that fever is not a good measure, but it is widely used for screening. Can you comment on this practice? If someone has a fever, should they get tested? Is there a specific set of symptoms that will require getting tested?
Yeah, my point wasn't that the fever itself doesn't demand further investigation, and depending on whether the symptoms an individual has, testing for COVID may in fact be the right thing to do. The point I was trying to make was that the absence of fever doesn't mean that you're not infected, and that was the concern I had. So, you know, you're not feeling good, your friend's not feeling good, you walk in to you know, wherever and get your temperature taken and your temperature is normal. I'd be more concerned about the fact that you are not feeling well than I would that your temperature is normal. So.
And Howard Dukes with the South Bend Tribune, he asked, one of you said that a vaccine is at least 1 year off. Can you talk about how clinical trials work? Can a vaccine be rushed to market if it shows efficacy? And talk about this medication that the president is advocating for.
Yeah. Well, vaccines, like any pharmaceutical product or agent, requires a fair amount of testing, goes through a variety of phases, generally from in the test tube to animal to trials in healthy adults, and then on. And these are done not only to prove efficacy, but also to ensure that they are safe. And one of the reasons it takes so long is just to ensure the safety. What is happening now is that some of the safeguards have been taken away. And we're trying to accelerate the process of bringing up these vaccines. There are a number of different, I've read about at least 9 different companies now working on vaccines and trying to bring them up from scratch. We'll see what happens. I'm sure you've read the same I've read, Bill Gates trying to fund, you know, a number of these endeavors. Mark, you may know more about this than I do.
No, I think that's a great summary. One of the concerns, as Bob said, is that you know, some of these safeguards have been taken off, and Bob and I, in the course of our professional careers, have seen vaccines introduced and then pulled from the market because they had safety problems after all of the very rigorous testing, you know, that's required. And so the concern is, you know, if you remove some of those safeguards, we're likely putting people at risk, but it's also a virus that's killing people. And so trying to balance those risks and benefits is a challenge.
In terms of the drug that I believe you were referring to was the hydroxychloroquine that Trump has been trumpeting. This is a drug that has been around for a very long time. I myself have used chloroquine, have taken chloroquine to prevent malaria. Hydroxychloroquine is used to treat some rheumatologic diseases. And the problem that we see here, as with any drug, is there is, we like to see the data, the evidence that it really does work. There are a lot of snake oil salesmen out there, and I prefer to see the evidence that a drug, 1, works, and 2, is safe before I give it to a patient. In the case of hydroxychloroquine, if used in appropriate doses, it's a relatively safe medication, so that at least is good. But I also don't want to give false hope to any patient and the science behind the drug itself. Now, if it's a live or die situation and we're throwing the kitchen sink at someone who's on a ventilator and dying of COVID, would it be reasonable to use hydroxychloroquine? Yes, I think it would be. Situation, and one is watching for the potential side effects very closely. I think it would be reasonable to try it in that situation. Otherwise, I don't think there's cause for this drug until we know more.
Is this our new normal? We've seen globally there's been outbreaks, bird flu, corona. Can you say that we are learning about what we're learning about this new normal? How will this inform public health policy as we go forward?
In a sense, it's a new normal. In a sense, it's not. Mutations have been occurring since long before man and women were on this earth. In fact, we're on this earth because of mutations, many of us would believe. And so these mutations have been occurring, will occur. This particular virus, coronavirus, like influenza, is, there are going to be various different strains and mutations of it, and it will change. But what's different, I think, is that we are such a global community now that when a virus jumps from, as in this case, a bat into a human, and the humans are now traveling so quickly around the world, it's so much easier for this sort of a pandemic to take place. Whereas in the old days, you had to walk a day to get 20 miles, and the likelihood of transmission just wasn't there. So in that sense, it's not a new normal, and it is a new normal. In terms of the precautions that we're going to have to take, you may have heard Fauci talk about we're not going to be giving handshakes anymore. I think that's probably true. We will be much more reticent to be in physical contact with our neighbors, our acquaintances, and our colleagues.
Just a general question is, says, are you concerned about mitigation efforts locally?
I do think some people have not taken to heart the advice and the guidance that have been given. I think to a large degree, I think the community has done a terrific job of social distancing, of physical distancing, in their behaviors. But there's still a subset of the community that unfortunately have not adhered to this, and that concerns me.
Yeah, I agree with that. We know of certain subsets that, they must feel invincible. They think it doesn't apply to them. By and large, I think the community has done very well. My concern is that they say, okay, great, we've done this for the last 3 weeks or so. I'm tired of it, and I'm ready for my life to get back to normal, and that they'll become more complacent about it. And that's why I often talk about the, just this once, it won't hurt if I go visit my friend or neighbor, have a coffee or have a beer with them. If I do that, but everyone else is following the rules, we'll be okay. But if everyone adopts that attitude, then it just increases the exposure and increases the risk. And so this is, while there's some encouraging suggestion, at least, that we're seeing some benefit of all these efforts, now's the time really to double down and say, okay, this is important and it matters, and we got to continue to be good at this, really, to flatten this curve.
This is also from Elizabeth. Speaking of snake oils, will you please speak to how to manage symptoms appropriately, including what not to take or to take to manage these symptoms?
Unfortunately, the best one can do is supportive care here. In fact, there was a question earlier as well about at least if I interpreted the question correctly, is fever good? You'd think we would know that in this day and age as to whether you have a fever, should you allow your body to continue to have a fever, or should we take some Tylenol or aspirin to bring the fever down. In fact, there is a little bit of data going back 30, 40, 50, 60 years ago to suggest that, in fact, fever may have some adaptive value here, and to not treat a fever in the first 24 hours may, in fact, shorten certain viral illnesses. This is not terrific data that I'm citing for you, but I have read some of these studies. Beyond that, there's really nothing, unfortunately, that we can do to shorten the duration of the COVID-19 illness. Obviously, staying hydrated is important. And beyond that, the usual things that your grandmother taught you, or my grandmother taught me, it holds true here. I wish I could add something more than that. The one thing that we do worry about, of course, is because the virus adheres to receptors down in the lungs, if the individual is starting to get short of breath, that is a sign that the disease is progressing. And we recommend at this point that individuals with minor symptoms stay at home. But if one is beginning to have shortness of breath, that is concerning, and that, in my opinion, demands a further evaluation by a physician.
Okay, thank you. Did you want to say anything, Dr. Fox?
No, I think that sums it up really well. One of the really interesting features of this infection is that there are individuals whose oxygen level in their blood is really low, even though they aren't that short of breath. So we always highlight cough and shortness of breath as two of the worrisome symptoms. And yet there are people that are breathing perfectly comfortable and their oxygen level is really low. And those are the really tricky ones to identify and to keep an eye on. So I think that's one of the real challenges here.
If I
Well,
could,
go ahead.
The one question about the mitigation efforts, and there was a qualifying comment here about our opinion of the county city's response. And if you have just a minute, I would like to respond to that, because
Yeah.
I'm impressed with what Mueller and Castelny have done here, and I think they've done a very good job. They were rightfully concerned about closing the public school system because of the adverse effect that it would have on so many of the school children and their parents, and recognized that there were a number of adverse consequences of closing the schools, yet they went ahead and made that very difficult decision. I think they did it at about just the right time to close the schools. I think they've done a very nice job of sending the message to the business community to close their doors, of the non-essential business community, and that's a very, very difficult decision to make. And I know that they're really looking hard at when to lighten up some of these restrictions.
Well, thank you for that. I really appreciate both of you being here and taking these questions. And this has gone on beyond the time that we had told you. So we want to just thank you both again for taking the time to answer these questions and being here with us. Before everyone logs off, we do want to remind folks that you really should look towards applying for an absentee ballot application. And if you look in the chat here, we've actually included a link here for you to go and download that application, and you can fill it out and print it out and send it in, or you can submit it electronically too. You can email it to the county agency. So we want to thank you all just for being here in attendance and for submitting questions. We will continue this series next week, Thursday, with a conversation about a bill regarding a police complaint board that has been put forward by Councilman Henry Davis Jr. and Councilwoman Lori Hammond. So again, thank you all, and thank you to our two health officers for being here.
It's been our pleasure.
For organizing it.
All right, have a great night.
You too, thank you.
Thank you.